So we're good to go live. Good afternoon, friends. Good afternoon, students, and good afternoon to the distinguished speakers for today's webinar. So here we come up with another interesting topic today on careers in nursing sciences and the way forward. We had a good webinar yesterday also on the title on the allied health sciences. And today we bring you the most sought after career in the health sector, which is nursing. Before I go on to introduce the distinguished speakers for the day, I would like to thank all the students, especially the parents of the students who have been in touch with us to have more details about the university, more details about the program, more details in terms of how the university along with its hospital is able to give one of the best ever programs available under the nursing profession. So here we are today. A nursing career brings a person a great deal of zeal and fulfillment. The nurses have the capacity to make a difference in the lives of people with their love, care, and affection. The profession also allows career advancement that gives an additional sense of personal fulfillment. The work put in is equal to the reward. Skills will be learned that can be adapted to life and work situations. Nurses help patients and families during high-end times of need. With this, I take the opportunity and the pride to introduce our distinguished speakers for the day. Speaker number one for the day is the Honorable Vice Chancellor, Dr. K.N.B. Murthy. Sir is the Professor for Computer Science Engineering and the Vice Chancellor at Dayanand Sagar University, Bangalore. Sir has been the former Vice Chancellor at PES University, Bangalore. Sir holds a bachelor's degree in electrical power engineering and a master's degree in electrical engineering from Indian Institute of Science, Bangalore, and a PhD in computer science and engineering from Indian Institute of Technology, Madras. Sir has worked as a research specialist in parallel computing at New Mexico State University, US, and is currently a member of the Karnataka State Higher Education Council and the Academic Senate member of IIIT Dharwad. Sir, a warm welcome to you.
Thank you, Shinde. Thank you.
Our speaker number two for the day is Dr. Pushpa Sarkar. She is the Dean for the School of Allied Health Sciences as well as the Nursing Sciences. She is currently working as the Dean for Allied Health Sciences and School of Health Science. Worked as a director as Rajiv Gandhi University of Health Science. She is the board member at various reputed institutions of Karnataka and a visiting faculty of Medical College of Karnataka. Ma'am, a warm welcome to you.
Thank you. Thank you, Mr.
We have two distinguished speakers from the industry and we'd like to introduce Mrs. Selma Thomas. She's done her BSc and MSc which specialized in medical and surgical nursing from Christian Medical College and Hospital, Vellore. She's also done her executive diploma in healthcare management from LIBA and CMC. A diploma in palliative care from IAPC and resource person. She's a master's in psychology. A diploma in clinical counseling from Madras University and working as a deputy nursing superintendent, IP operations at Sri Ramchandra Hospital, Chennai. She has diligently contributed to clinical services, nursing administration, nursing education, and research, recruitment, and training at premier institutions like Apollo Main Hospital, Chennai, Apollo College of Nursing, Chennai, Umayalachi College of Nursing, Chennai, and CMC, Vellore for over 20 years. She's an NABH assessor with Quality Council of India. A warm welcome to you, ma'am.
Thank you. It's a pleasure being a part of this event.
Thank you, ma'am. Our speaker number 4 from the industry is Ms. Joy Kezia. She's a chief of nursing at Apollo Hospitals, Chennai. Completed her BSc nursing from Christian Medical College and Hospital, Vellore, and MSc nursing from Umayal Achi College of Nursing with best outgoing medalist from Dr. MGR Medical University. Done her MBA from the University of Madras. Healthcare Leadership Program from IIM Kolkata, Healthcare Leadership in Trauma Care from Boston, US, Harvard. Overall 18 years of experience, including 8 to 10 years in administration as NICU care nurse, clinical instructor, lecturer, nurse educator, nursing coordinator, deputy nursing superintendent, and chief nursing officer. A flexible transformation leader, self-motivator, and passionate towards inclinating strong organizational, managerial, and the research skill. A warm welcome to you, Ms. Joy. Our speaker number 5 for the day is the principal for the College of Nursing Sciences, Professor Dr. Sharmila J. She has vast experience from the post of lecturer to principal. She has a certifications in basic counseling skills, cognitive behavior therapy skills, and proficiency in principles of United Systems of Medicine. She has organized and participated in various workshops and conferences in state level and national level. She has presented scientific papers in various platforms. She is ambitious, task-oriented, and committed in nursing education and clinical fields. A warm welcome to you, ma'am.
Thank you, sir.
I hereby request the Honorable Vice Chancellor, sir, to set the context and to share his views. Over to you, sir.
Thank you, Shinde. Good afternoon, respected co-panelists, the organizers, the students and parents, as well as the invitees. I'm extremely happy to be a part of this campus info session. Dayanand Sagar University has been organizing campus info sessions to provide information to the students for making an informed choice. The objective is to get to know about a program of study, mainly from the 2 or 3 important perspectives. The first perspective, what is that they're going to study? Second, where exactly the job opportunities exist? Then what specialization would be the right specialization for a student to pursue? This is exactly what the experts are going to talk about. We have an eminent team of experts giving you all the information. I would like to make few opening remarks, so that the respected experts would take it forward. First, nursing profession is always been the noble profession and considered to be one of the best professions all over the world. That's one thing all of us need to remember. It's considered to be the most prestigious profession all over the globe. Second, the career opportunities for a nursing graduate, a nursing professional, is phenomenal in every country that is there in this world. Therefore, the opportunities are going to be plenty for nursing professionals. Before you exactly decide the program of study, you need to know some of these following things. First, you need to know what the future is going to be, how the future is going to look like. 4 years down the line, because when you graduate 4 years down the line, then you need to know how the world is going to be. What is that's going to be there for a nursing professional to handle? Second, what are the areas where a lot more nursing professionals are required? Third, you need to know is what is your passion? What is your passionate area? There are multiple areas within nursing profession. You decide what would be the right kind of thing, which is close to your heart. Then you also need to make an audit of the talent that you have for nursing profession. Then you also need to know about the rigors of study, how much effort you need to put in to become a, a professional of highest order in the future. Of course, you also need to look into one more aspect, which is nothing but what is the cost involved, whether it's affordable for you to take up a profession within your budgets. This also needs to be looked into. Let's dwell upon each one of these points. First, what are the job opportunities? The job opportunities would have plenty because nursing professionals are required everywhere because healthcare is becoming a primary area or primary subject of every country. That's the top most priority. The future nursing professionals need to handle a lot more instrumentation than what they were doing in the past because there are a lot more research that's going to be put in, a lot more devices are going to enter the market, thereby the preventive healthcare becomes of highest priority, thereby there are a lot of tests and other things are going to be done a priori. Therefore, it's necessary for a nursing professional to understand how to use this instrumentation. Therefore, that's one skill that's required. Second skill that's required is you need to know about technology, particularly the computer technology needs to be understood quite well. Then coming to the areas, what are the areas? There are multiple areas where the experts will tell you, and you can decide which area is going to suit your line of thinking, your way of working. You also need to do that. Then you need to look at the talent. Look at the educational achievements, accomplishments, the +2 and etc. Then see what you're good at. Then if you are identify what you're good at and also the area in which you're going to work, there's a close match between the two. Then in the future, the rigors of study will be much higher than what was there in the past because a lot more to learn. There's extremely complex kind of things are going to exist. Therefore, it's necessary for every one of us in the future to upskill, to reskill, and go through transformation learning. Therefore, be ready to put in the kind of hard work required to become a successful nursing professional. Now you have decided to do a nursing program. You also decided to do a nursing program in a specialization, maybe cardiology, maybe the neurology, whatever area they're going to decide. Then you need to decide which is the university where you need to do your program. The university which is going to provide you an ambience, an environment for learning is the university you need to choose. A university which encourages multidisciplinary learning is important. What do you mean by multidisciplinary learning? Though you're going to specialize in one area, you also need to know the related areas so that you become a better accomplished nursing professional in the future. Then you need to join a university which would provide an opportunity for experiential learning. What am I experiential learning? Learning by doing. Is it possible for you to do the training along with the study? Is such a thing exists? If that university has qualified faculty, has the provision for experiential learning, is the university you need to look for. Is the university you need to study. I'm extremely happy to tell you that Dayanand Sagar University is running this nursing program along the side of the medical school. Thereby, you will have there's a hospital of the university itself. Therefore, the greater opportunity for experiential learning in the nursing program. So the Dayanand Sagar University is well equipped to offer all the things that I mentioned. And I take this opportunity to congratulate or compliment the admission team for organizing these campus info sessions to provide the complete information about the various programs of study, including nursing, so that students make an informed choice. With these few words, I wish each one of you best of luck. Listen to experts, make a notes of what has been said by the experts, and make an informed decision to join a nursing program, and wish each one of you to come out as successful nursing professionals in the years to come. Thank you. Thank you very much.
Thank you so much, sir. I now like to invite the Dean Ma'am, Dr. Pushpa Sarkar. She'll be touching upon the topic nursing as a profession in the medical industry. Over to you, ma'am.
Thank you, Mrs. Shende. Can you enable my screen sharing?
It's enabled, ma'am.
It's enabled.
Yes, ma'am.
Is it visible, Shende?
Yes, ma'am. It's just opening up, I think. The PowerPoint is here. It's open.
Yeah. Okay. So, a very good afternoon to Honorable Vice Chancellor and the Chief of the Admission, Mrs. Shende, Principal of the Nursing Sciences, Ms. Sharmila, our guest speakers for today, and the participating students, and also the parents, if they're there. A very good afternoon to all of you. So today we are here to give a view of what nursing sciences would be. I know all of you are interested, hence you have been logging into this particular program. Now, all of you know, this is one profession where you can't say I don't know about it. Each one of you would have visited a hospital at any point of time, not as a patient, but to visit a patient, or you would have gone as a patient or whatever it is. Now, whom do you see there? So you see nurses, right? You see, once you go to see the doctors, more than that, you see the nurses everywhere. When you enter a ward to meet your patient, you see nurses there. You don't see doctors so often there in the hospital unless you have an appointment and go and meet the doctor. Now, nursing profession is the most noblest profession, if you ask me. Why do I say that? Because the word nurse itself is derived from a Latin word, which means to nourish. That's what it is, that to provide nourishment, to provide. That's what it means, not in the literal sense. Now, what does nurses do? They are the caretakers. They are the backbone of the health industry. Now, we are enough of COVID. We have talked about the pandemic everywhere, but all of you also know about the pandemic, and that's why the entire world is looking towards the healthcare industry as of now. Now, everybody, you would have visited either to get tested or, or have COVID and visited hospital for further treatment, so on and so forth, or you have an idea of what is happening around you, thanks to the pandemic. And there also, you've been seeing how these nurses have been working with effort morning till evening, or even throughout the night, 24 hours, 36 hours, they are on duty. Hence, I will tell you that this is the most noblest profession, a selfless profession, I can call it. Now, healthcare sector also, you know that the health industry is rapidly growing, and also India is also becoming a global healthcare hub. But you also know that where it's been unable to meet the health needs of the population of this particular country, so we are in dearth of these healthcare professionals. Now, at Dayanand Sagar University, we are at the mission to provide the skilled manpower to the healthcare sector. Now, before I proceed, at Dayanand Sagar University, I just want you to have a tour or a look at all the facilities what our Honorable Vice Chairman was mentioning, where we want any professional going out of this particular university as a skilled and confident professional, be it any profession. So when it comes to nursing also, training is very, very important. The patient needs to be cared, and the nurses need to know how to care or what is required to be taken to every different patient. Now, how is this possible? This is possible by undergoing a good training, undergoing a varied exposure to various clinical cases, or in a hospital where all the facilities are available and you get cases, emergencies where you look into. Now, where does this happen? It doesn't happen in a small nursing homes or small setups. In a medical college hospital, especially a teaching hospital, you get all cases because you get all patients from various, like, rich, poor, black, white, whatever, irrespective of the caste, creed, you have all patients coming into these hospitals, teaching hospitals. Therefore, you see varied cases also, all type of cases are exposed. And although management of how these cases are managed. So hands-on, you have practical training. You are exposed to each of these scenarios, how every patient presents and how you're going to manage. So such training is given, is provided by Dayanand Sagar University in the College of Nursing Sciences under Dayanand Sagar University. We have a teaching hospital, Chandrama Dayanand Sagar Institute, where at Arohalli Medical College and Research Institute. So I would take you a quick tour of where, you would be. I'm not able to. Yeah. See, you can have a look at there's a teaching block, the medical college teaching block, where you undergo the training. Now, this is also the emergency block, the hospital. You have the emergency entrance here, you have the hospital, and you also have a huge block the other side, the hospital. It's catering to all the patients in and around Kanakapura, Ramnagar, Bidadi, all the patients. It's been catering there. So you have all the specialty and also super specialty departments at this particular hospital. And I also want to mention that all the students who have been taught at this particular medical college, the medical students who are undergoing the training, the same set of teachers will be training you in those particular subjects which come under the medical. Like, for example, this is the anatomy dissection hall where you can observe, you can see, you have such a beautiful dissection hall where the dissection happens. So you see the cadaver, you get hands-on training here. So you get to view everything. So along with the medical students. Now, certain subjects are taught by the teachers who teach the medical students. And there are other subjects who are taught by the professionals in the nursing profession. Now, there's the anatomy museum and physiology lab where you do experiments for your blood count, and others like your bleeding time, clotting time, and all that. There's a clinical physiology lab where you're made to learn how to measure a blood pressure and how to examine clinically. There's a biochemistry laboratory where you also learn to do different experiments, how to measure the blood sugar, blood urea, and all the tests on the samples of blood, urine, and so on. There's another view. And there's a microbiology lab. And this is where you also see, if you had gone for a testing of your RT-PCR, you must have been already knowing about what is RT-PCR. The test done for the COVID test. So this is a place where it's been done. This is also the microbiology lab. And this is a radiology department. So, and this is for ultrasound. And this is the ICU, where the patients are kept in the intensive care unit. There's a dialysis center, and there's a post-op ward. So every post-op ward, you have a nursing station overlooking all the patients. And this is the operation theater. And this is an OT complex. You see so many OTs. There are many different OTs, designated operation theaters for general surgery, maybe for ENT, and for orthopedics. They have a designated operation theaters. And this is the demo rooms where you're giving demo before you get into your practical classes. And this is the lecture hall, fully equipped lecture hall. And this is the entrance for the library. And you have a huge library with a lot of journals and you name any books, all the books are here. And this is the digital library where it's provided for you to go browse the internet for your journals, for maybe whatever you want to look into, certain publications also. And there's a gym facility which has been provided. And there's a hostel blocks and the bus facilities. And this is what I was talking of all this time. And I was telling you about the nursing, was nursing, and nursing is caring. And as per this, you can see this nursing is an integral part of the medical system. Now, no more, you cannot say now medical system, when you say it's medicine or medical system, doesn't mean it's only doctors. It cannot be only doctors now. Any hospital, any huge health industry itself, I can say, you just remove the nurses. It's not complete. You go to a hospital, you ask all the nurses to go to the hospital, and doctors alone cannot run any hospital. So any healthcare industry should have all of them. It should be multidisciplinary. The nursing section being the backbone providing the nursing care. So the nurses are the ones who know the patient. That's why I say nurses are the integral part of the medical system. They are the caregiver, they're communicator. When we say communicator, when we mean that, they communicate to the patient what is to be done, what is happening to them on a daily basis. When they go look at the patient, it's not on a daily basis, on the hourly basis also, what they need to be done, how to take care of themselves. There may be a teacher, there may be a counselor. The patient, patient attendants are there. You counsel them, you counsel the patients also. There may be a leader, manager, and many more. Many other. There's so many roles they don these. So when I say that, if you observe in any of the wards, if you see, the patient suddenly says, oh, I have pain, or if the patient suddenly complains of something, it's the nurses who rush to the patients. They're there always, 24/7, the nurses are in the ward. So they know the patients by their name. They also know the relatives. They know about the entire history, sometimes the family also of the patients. So they become almost a part, the patients and the family become a part of the family of these nurses. So the entire ward, the nurses whom they take care of, they become a caretaker there. In all ways, in everything. Sometimes they'll be solving their personal issues also. So there's a motherly attitude. That's what we say for the nurses. Now, the nurses' role earlier was only that what people think is the doctors, they give instructions and the nurses follow those instructions. And I think the duty of the nurses is to just go give injections, give them tablets in time, change the sheets, change that. No, it's not so. The nurses now, they play an important role in the assessment, in the diagnosis, even in the prognosis. In the sense how this patient will, in the next, the procedure, what happens to the patient next, the development. the planning, how this planning, like the treatment has been told them, the management has been issued, how to be managed has been, the instructions have been issued, but the nurses plan how this to be done. And also implementation and evaluation, we mean that once this is done, once this particular management is implemented, how is the patient faring? Because they are the ones every day going to the patients, looking at the patients. So they know how the patient is coping up. Is he improving or is he not improving? So immediately they communicate to the doctors and also plan what else can be done to make the patient comfortable, to make the patient heal faster, and so on and so forth. That's why in the last international, I think the previous year, in the International Nurses Day, it was nurses to lead. That was the logo last time. That means to say the nurses are leaders anymore. They are no more just follow the instructions. They also to lead, to contribute in all the things in the management, how to manage, about even what the medicines to be given, all everything. They have a role in everything. So the role of a nurse is changing. So these are the qualities of a nurse, what we expect. They're caring, they're empathetic towards a patient, they're detail oriented. This is what I was telling you. They're detail oriented. That means to say that they know everything about the patient. And they're emotionally stable. They need to be, because they can't, when the patient breaks down, they cannot break down. So they need to manage certain critical conditions, critical issues. So they need to be stable, adaptable, hardworking, quick thinker. This is very much important to be a nurse. Very, very much important. Like in any emergency or whenever a patient is brought in the ward quickly, if there's some actions to be taken immediately, they need to be quick in doing so that that golden period is not lost. Physical endurance, of course, because they need, they're running around all the time, always occupied. You don't see a nurse sitting anywhere, any point of time. So judgment regarding the patient, communication skills, very, very important, and responsibility, of course. And here at Dayananda Sagar University, we offer these courses, and anyway, this will be elaborated by our principal, Dr. Sharmila. And if you come to the career opportunity, this is what every one of you are looking into, I know, because the parents also will be asking, where will our children be after this? After nursing, next what? And even where will we be placed? Even the students also, after PU, you don't know what to do. There's so many courses. There are people who are service oriented. When we are explaining all this, it's very clear to you what is expected of a nurse. So if you feel you fit into this, or it's really, what shall I say, service oriented, and the students need to take up this particular profession if they are really concerned about the general public also, I mean to say. Now, career opportunities are so many. You anything under the earth, you can fit in there. You can go into the universities and you become education institutions. By doing your post-graduation, you got specialization like medical, surgical, pediatrics, and psychiatry nursing. You have community health nursing. You have various specializations here. And we also have this critical care also where you've been trained. So you can do a master's and you can go teach the nursing students, or hospitals, nursing homes, this you know already. And psychiatric nurse practitioner, you can even practice. And you have physical therapists, occupational nurse, public health, forensic, legal nurse consultant. You can take up this also. There are many legal issues. There are many legal issues which you have to face, and you should know what is the legality in the nursing practice. So you can also become a legal nurse consultant. Then you have this, what shall I say? You have the, I'm just put it up here. You can see all of these, what I was mentioning just now, the universities and all this, legal nurse consultant, and you have this nurse health coach. You can also be a social worker, get into nurse informatics, telemedicine. As you must have heard of telemedicine, when doctors, they consult the doctors, over the net to give suggestions, to ask for treatment and improve. Nurses can also get into that. Online, you can do online consultation. So there are certain things where the patient need not come to doctors. They need not come to doctors to ask each time, what if there's small problems with them, follow up after the surgery, they discharge, go home. Every time they need not come to a doctor to ask. There's so many things which they can take instruction from the nurse. For that, they need not come to the hospital, or they can take it on the online consultation with the nurses. And career opportunities also continued. You have so many. You can just look into this. You have home care, you have home nursing, where many of the geriatric patient or bedridden patients need nursing at home. So nurse educator, nurse practitioner. You can see so many of these. Nurse anesthetist, oncology nurse, specialization in oncology only for the cancer care. This is cruise ship nurse, like a marine, serving in the Navy, or not only the Navy comes under the defense. You can be any cruise. You have there's a special course where you can serve in the cruise, and you can join the army, in the prisons here, in the pediatric nursing. The list is endless. The list is endless. There's so many opportunities, India and abroad, both, wherever, across the globe. There's a lot of opportunities, and many nations wanting this nurses, particularly in US, UK, and also in Australia, the high demand of nurses from India. So you need not worry about, if you're worried about job opportunities, there's no looking back other than the health sector. A nurse is never discharged off from duties or laid off. There's no recession for nurses. Whenever there's a recession, you must have heard, people lose jobs, but there's no recession in healthcare industry, and particularly for nursing, there's no recession. So you can just say that in one word, you can say nurse is to describe a person who is strong enough to tolerate anything and also soft enough to understand anyone. And the last para, if you see, you'll understand the importance of nursing when we say that nurses are there when the first breath is taken. That means to say when the child is born, when a child is delivered, when a child enters this world during the delivery, the nurses are around. And also when the last breath is taken. Initially, there are doctors, many a times in the normal deliveries, doctors are not, the nurses do the delivery, or sometimes the doctors. When the last breath taken, many a times doctors will not be there. It's the nurses around, the last breath is taken. So although it's more enjoyable to celebrate the birth, it is as important to comfort in the death also. You need to comfort the patient and the relatives in death is very important. So with this, I end this particular webinar and assuring you that once you people get into Dayanand Sagar University, the College of Nursing Sciences, we see to that every single the nursing professional will move out of this particular institution as a skilled and very confident professional, because here you must be having we have Indian Nursing Council, which is the epic body which regulates, which will be told to you later. But I would assure you that other than what has been prescribed by the Indian Nursing Council, over and above that, we give you specific training also, other specific training and certain value-added courses, we call them as certain, where you have the certain certification courses, which is an added skill. That's the speciality of our particular nursing institution. Thank you all, and wishing all of you all the very best. Thank you.
Thank you so much, ma'am. I now like to invite Mrs. Selma Thomas. Over to you, ma'am.
Where do I stop sharing?
Ma'am, you can stop the screen sharing. Yeah, thank you so much, ma'am. Yeah, Selma, ma'am, are you?
Am I audible?
Yes, ma'am, you are audible. Do you want me to present your slides?
If it's possible, I'm just trying to share the screen.
You'll have to then share the PPT with me. But you have been given the rights to share the screen. Just go down. There's a green button there. Screen share it.
Okay.
Just click that. And then in the box, you will be able to see your PPT. You can click that and then say share. Yeah, you can go to the presentation of yours.
Is it clear?
Yeah, it's clear, ma'am.
Okay. May I start now?
Sure, ma'am. Please go ahead.
Okay. I really want to thank the university and its management for giving me this opportunity. And to start with, I'm a very passionate nurse, and I'm really happy to be a part of this event to share my passion and to see the younger population being inspired by it. And as we all know, there is a global burden and there is a lot of demand, as Madam was telling, there's a lot of demand for skilled healthcare professionals. And we are hard pressed for creating them, training them, and making them the sound professionals who can take care of others. So when we're talking about nursing, nursing is a fantastic profession. And of course, COVID has brought us to the forefront where everybody made it. It was really visible for everybody to see how important we are and what kind of care we are giving and how inevitable it is to run a healthcare profession. Without the nurses, it is going to be a real suffering spot. And nurses have contributed to so much in every aspect of patient care. And if you see, there is a lot of shortage of nurses worldwide, and almost like it is shooting up. And in another 15, 20 years, probably when this generation is in my stage, it will be somewhere around 800,000 deficit. And if you take up nursing, definitely you can serve the community at any level. And nurses have one of the most secure jobs, and the job opportunities are plenty. And above all, you will be touching the lives of people who you will come in contact with. And nurses being the integral part of healthcare, and it is a very essential part. We really contribute so much to every small aspect of healthcare. And we reach to individual patients, their family members, and everybody who comes in contact with the patient and the community at large. And it is like we touch almost every walk of life. We are a healer throughout every aspect of life's process, from the first cry of a newborn to the last breath of the dying. The nurse is one person who's 24/7 with the patient. And you may have seen times where there is nobody for a person, and especially the vulnerable population when they are admitted. You may find that either the attendant with them is not skilled enough to share the burden, or there may be no one with them, especially when you consider the geriatric population. At that time, you know that one word, don't worry, I'm with you, I'll be taking care of you. That makes a lot of difference. And that word comes from the nurse 24/7. And nurses, they are known for balancing their lives. Even though if they are not able to manage their personal and professional lives in a balanced way, but I can assure you, nurses balance the patient expectations and the satisfaction. When the patient comes inside itself, they assess, they feel what is needed for them. And then from there, they start off for how to satisfy. We all know life is all about memories, right? So when we turn back and see something, what is that remains in our lives? It is the memories, how well we had enjoyed life, how well others had taken care of us, how well we had interacted with others, how well was our interaction with others. So there is a lot of memories, and nurses, by balancing their roles, they create wonderful memories. And how are the nurses actually performing? They are actually promoting the well-being of people. The health and well-being of the people are promoted, and they prevent illnesses. You know, we do a big deal when it comes to vaccination, when it comes to care of a mother when she is pregnant. when it comes to preventing any infection for a child or an adult when they are hospitalized or at home, restoring health, especially when they might come with a minor illness, major illness, surgery, any kind of trauma. At that time, who is there in restoring their health along with the doctors? It is the nurses who are 24/7 taking care of the patients. And next, finally, it is the care of the dying. At the end of the process, the care of dying, giving them a farewell in a very memorable way, creating memories in the minds of those who've been taking care of them. It's in the hands of the nurses. And the roles, we have plenty of roles to play as nurses. We are more confined to thinking it is only the nurse and the patient and the caregiver. No. A nurse as a caregiver is an educator. She's an advocate who talks for the patient. She's a manager who manages things in and around the hospital and the ward for the patient. She provides the care. She researches, she finds out what is best and provides it. She's a leader. She takes care of her team to take care of the patient, and she collaborates with all the health is not just a nurse or a doctor. There is a big team involved. And this nurse, she collaborates with all the team members to provide the best care for the patient. And in the hospital, there are ample roles to play. It depends on whatever specialization you want to take. It can be right from critical care to mental health to emergency department to operation room. There are many subspecialties. It can be related to oncology, that is cancer patients. It can be related to heart. It can be related to respiratory illness. It can be related to newborn. If you love the children, pediatrics, there is so much that you can do for each and every child, every person. And what about the growth? There is a lot of growth. You start as a staff nurse. Then when you're improving your administrative capacity, you move on to become a ward in charge, then a nursing supervisor, then an assistant nursing superintendent, then the deputy nursing superintendent, then the nursing superintendent, and then the director of nursing or a chief nursing officer. And in the community, you have a big role to play because prevention of illness is a major role from our side. So at the community level, nurses play a very efficient role and especially with the present government, there is ample roles to play for nurses. And of course, if you're interested in settling abroad, there is a lot of opportunities. Worldwide healthcare burden is increasing. But primarily, I would want you to serve our own country because we are in major need of healthcare services. And what about employment opportunities? You can work from any agency to surgical centers, long-term care, home care, any organizations as administrators, nurse practitioners at outpatient unit, at inpatient unit, at clinics, at when patient is having a cancer or any debilitating illness and they want rehabilitation for long-term rehabilitation, for hospice, where there is palliative care given, there is ample employment opportunities. And nurses who are working hard, they have a wonderful growth prospect. I think Joy will be telling about all the prospects that we have in our profession. And definitely there is sufficient support throughout. If you see the nursing program, it starts from the basic training as a nurse, and then your post-graduation. Then you can go on to do your PhD. You can go for a postdoctorate. So Dr. Sharmila is a good example. And if you're interested in doing specialization into a particular area, you can go into different specialization depending upon where you want to work, what you want to specialize in. If you are interested in intensive care unit, there are special roles to play there. If you're interested in newborns, there is a special role. If you're interested in heart and heart surgery, there's a special role. And if you're interested in emergency and trauma, there's a special role. And in all these roles, there are ample certification programs and educational programs that are available, which can build you up. And I just want to project a few of the roles that you can see when you're coming into a hospital as a nurse. Apart from the staff nurse, you can be a nurse educator. You can be an infection control nurse. In COVID, you would have seen there's a lot of infection prevention and spread of infection that had to be propagated. The infection control nurses played a major role in it. Nurse managers, nurse researchers, every small aspect, depending on patient's need, they find out and they make sure the best is available for the patients. Legal consultants, forensic nurse, we are all moving towards it. Nurse anesthetist, community-based roles, and those are really interested in human form and its contribution. Definitely community health. We can contribute a lot in the preventive aspects. Emergency in the flight. There's a lot of choppers that are used as ambulances. There you have a definite role to play. Case managers. There's a lot of specialized roles like wound case manager, pain case manager, some tissue viability nurse. Then there is a lot of like when infection prevention, when there is a DVT, deep vein thrombosis to prevent it. Then there is a IV, the people are having IV infusions to prevent IV complications. There's an infusion nurse. So there are case managers who take care of patients from nursing. Telenursing. Let's say it's a very remote area where there is not proper healthcare facility. A skilled nurse can actually support the healthcare facility on this other side through telenursing, guiding the person who is taking care of patient from a facility which can actually guide them. And definitely, nursing is a challenging job. Who can become a nurse? Anybody who has compassion. Look at yourself. Look at the person beside you. Look at the person in front of you. Do you feel for them? Do you feel their pain? Do you feel that you have to do something to relieve their problems, relieve their pain, to be with them, to support them? You are the person who has to become the nurse. You are eligible to be a nurse. Only thing is when you're selecting the profession, make sure you join an organization where there is a hospital facility, where you're able to see people, touch, feel, and hear, and talk, and learn about them. You will become one with them and be empathetic, and you will become the best nurse. And definitely, among healthcare workers, nurses are applauded by governments and citizens for their selfless contribution to the society. In COVID, I must say, it was the nurses who were full-time inside the COVID wards and ICUs, completely taking over healthcare in every aspect. Nurses may choose to work in one permanent setting or may take short-term assignments like traveling and fulfilling temporary projects. But remember, there is a lot of opportunities. And being a nurse is definitely a blessing to you and your family. And a nurse in a family is equivalent to having an angel with them. Anybody in the family can vouch for their own healthcare needs. And thank you very much.
Thank you so much, ma'am. You may stop the screen sharing. Thank you so much. I now would like to invite our next speaker for the day and would request Ms. Joy Kezia to please share her views. And she's going to talk about the topic nursing promising prospects. Over to you, ma'am.
Very good afternoon and namaste.
You can go to the presentation mode. Down there are 3 buttons.
Are you able to view it?
Yeah, you can show it in the presentation mode.
Yeah,
but
yeah, I'm unable to start my video because the host has stopped it.
Anyway, you can just press it one more time. You can go down to the same view button. Or you
No.
can go to, you can again open it up.
No, the video isn't coming, so it's still okay.
Your screen is visible right now. Yeah, that's the PPT.
Yeah. Is it in the presentation mode?
Press it one more time. And now it is.
Okay. So I think only the video is not coming through, but it's okay if my voice is clear. I'm good.
Yeah, voice is clear, ma'am.
Yeah, right. Thank you. So thank you so much, Murthy sir, and everybody else who's given me this opportunity. A special thanks to Dr. Sharmila as well. Thank you to all the other speakers who have given a lot of insight on nursing. I would like to start with, the family background. The topic that was given to me was, promising prospects. So I was really thinking when we were talking about this, do you have to have a family background to become a nurse? I'm saying no, because telling 30 seconds about my own family, both my parents were government officials retired as professors. They were in colleges in the teaching line. So they least expected me to take nursing and to pursue it till this very day. Like what Dr. Selma was just saying, I'm a passionate nurse as well. As soon as I graduated and finished my master's, my father was thinking, no, Joy, you come back to the teaching line, be inside this college school. I went, I worked, but I liked serving human people much better, right? And what I understood was there is nothing more challenging than actually working as a nurse. I think the entire group of so many hundreds of nurses who are working along with me, they will all say the same thing. So family background, no, it's not required. I think you just have to start loving your profession. And if you're married or if you're having a nurse in your family, Selma was just saying you're having an angel with yourself, but please share the angel with the world. The world needs nurses, right? The second thing that I have written there is nursing is not the last option at all. So please realize that because she did not get into physiotherapy, dental, medicine, she's come to nursing, she or he. No, you can close your eyes and take it as your first option. It's a very beautiful humanities, it's a beautiful science. And as ma'am was actually showing the anatomy lab and everything else. Today, I think we've integrated technology into everything. When COVID hit us, even the smallest child in our family learned how to do a Zoom call, right? So technology has become interwoven today. So it need not be your last option. I would rather say it must be your first option for the very many reasons that you are a satisfied individual. Number one, you learn everything top to bottom, mind, heart, and soul. It's not just physical sciences, it's psychological sciences, it's spiritual sciences. It's a wholesome learning, And the third one is not because we nurses are needed as support services, but we are only needed. I've written that in bold caps for the reason that you have seen the world the past 2 years. The first person who walked into the ward completely putting up their hands and saying, yes, I will go and take care of a COVID patient was a nurse. I'm extremely proud to say that. There were lots of doctors who sat in the comfort of their homes, converted that into an OPD, and they were doing video calls, video consultations. Nurses can't do that. We can't. We did video to our families and making sure, did my husband eat? Did my daughter do well? Are they okay? And that's it. We are back with the patient. They were the most courageous people, and they are the only needed people. Many times people attribute organs of the human body to nurses. Sometimes I feel it's like building your own house. The deeper you go, the foundation is stronger. So the more number of nurses you have, the more number of competent, skilled nurses you have, the more stronger your hospital is going to be. You call it hospital, or you call it a nursing home, or you call it whatever. But the foundation has to be nurses. You have to put them right there at the foundation. Remember the last point, it is a lifelong requirement. Nursing does not get retired at all. Everywhere, everybody, anytime will give job to a nurse. Anywhere. Okay, so they don't really retire is what I say. They might retire because they're 58 years and they're out of a particular hospital. They need not work at a hospital. Today you heard Selma say that, and Dr. Madam also say that, she was saying how many different scopes we all have. We can grow and grow and grow. You look at me, I started my career as a staff nurse doing all the 3 shifts. We worked like that for 3-4 years. We went on to do masters. I ran and came back into the hospital sector. Because to me, if I spoke to few families, in Nikki, this morning I saw about a very sick 10 patients. Patients are not able to talk to me. They're all on tubes, lots of tubes and machines. But I spoke to their families. It took me 3 hours to speak to 10 patients and their families, because their anxiety level is so much. They want to know what's going to happen. Remember, all of us sitting here, we are not actually making money, saving money to go and spend it in a hospital. We all save money to go on a long trip, to go, visit other countries, to buy us a house or a car. But it's very unfortunate. Why I'm saying lifelong requirement, as long as we are being born, I think you need a nurse, right? So that's how much nurses are precious to the society. We need to protect them, foster them, and we need to give them a very beautiful growing environment, which I think the Sagar University is very beautifully doing. So like what Sir was saying, I was hearing Dr. Murthy talk to us. He was talking about upskilling, and I would add upscaling. Without learning, without putting yourself under the axe, putting yourself under the tractor, I have not grown. We need to love to learn. We must keep learning. So families, support your children, male or female. Nurses are beautiful to society. They need to upscale, they need to upskill. We have done separate, today I realize the need to learn even finance. So one of my courses that I went into IIM and did was because when I sit at meetings with the CEOs and the VPs of the companies, they speak numbers. So what stops the nurse? Nothing stops the nurse. Nothing stops the nurse. It's just your own mind, your mindset. Nothing needs to stop you. You can just keep upscaling yourself, keep learning, and then you can keep, go through that entire cycle of this metamorphosis that I'm talking about, which is a very beautiful thing to actually go through. When a caterpillar becomes a butterfly, it completely changes. That's how much your own nurse, your little child whom you have grown in your house, will completely change when she gets into a university like this. There is a complete transformation, a complete metamorphosis. You don't, when a butterfly comes and sits on you, nobody pushes away the butterfly. But if a caterpillar sits on you, you're very scared. You might have an allergy. Your skin is not good, right? So that is the type of metamorphosis nurses undergo. And once they have graduated, oh, they are so beautiful. They are really angels. And the last point is specializations. Yes, I have taken only the nursing specializations that I've written, from diploma to Doctor of Science, diploma, BSc, Masters, MPhil, and then, PhD, and the highest honor, which is Doctor of Science, DSE. These are all possible inside the field of nursing. So I think, as long as human beings are there, nursing has wonderful, promising prospects. It just requires a lot of thinking, a lot of common sense that needs to be put into the thinking. Get advice from the right people, put your child into the right course, and enable her to continue to function. Very often what I've realized is, once the nurse is married, she has a child, the entire family pulls her down. You don't need to go. No, that hospital has COVID, don't go. No, you can't do 3 shifts. You think hospital people will not become sick in the middle of the night? Do you think ICUs will shut down? Do you think accidents will not happen in the middle of the night? Do you think I will not come back as a patient? Anything can happen. But I think as long as the nurse is right there at your doorstep in a hospital, your life is very safe. So we are here to help our nurses, support our nurses, and to really make sure that they grow fast and they grow to be, wonderful people who can contribute to society. It's enough of us being consumers. We need to start to become contributors to the society. So thank you very much once again for the opportunity, and over to you.
Thank you so much, ma'am. Very well said and very nicely presented. I'm sure the students are going to get a lot of learning from this in terms of the very noble profession that they would want to get into it. Thank you so much for giving the very insights of what happens through or what actually goes through at the hospital with the nurses. Thank you so much. It's now time to invite the principal of the School of Nursing, Dr. Sharmila. And Dr. Sharmila will be presenting her thoughts and, of course, the details on the programs being offered, the outcomes, the internships, and the careers. Over to you, ma'am.
Thank you, sir. Permit me to share the slide.
Yes, ma'am.
So just a minute.
Sure.
So you're able to see my...
Not yet, ma'am. You need to get onto the screen sharing and then...
Sir, is it visible?
Yeah, it's come. You can go to the presentation mode.
Good evening. I would like to thank our Honorable Vice Chancellor, sir, who has given the overview of nursing. And thanks to our Dean, Madam, Dr. Pushpa Sarkar. Madam, thank you so much for enlightening us on the importance of nursing and also showing us the slides of what is about our beautiful view of our campus for at Harawali Medical College and the hospital attached campus where we are nursing courses is going to be started, and the beautiful labs, the facilities what we have at Harawali campus. Thank you so much, madam. And also my special thanks to the speakers, Ms. Selma and Ms. Kezia, for enlightening us on the importance of nursing, very beautifully described, and you have more your inspirational words on about nursing. Really proud to be a nurse, and also feel so proud that you have explained us very clearly, and the audience will be knowing what is the importance of being a nurse and why the nursing has to be selected. Thank you so much for that. And in spite of your busy schedule, during the work schedule, both of you have joined with us for the webinar. Thank you so much. And to move on with the PowerPoint, about Dayanand Sagar University, why you have to choose Dayanand Sagar University for doing your nursing course. So Dayanand Sagar Nursing, College of Nursing is established in the year 2002. As a university, we have stepped in, we have started taking baby steps from 2015 to equip the graduate nurse with the knowledge, skills, attitude, and to deliver a high quality education. Why is this quality education in Karnataka, in Bangalore, at Dayanand Sagar University? We do provide a quality of education. Why this quality of education is needed, and you know the importance of it too. But nursing, we provide our graduates. Once you graduate from our university, you will be able to give a true care about what the patient feels and how you have a significant impact in the care, what you touch when you touch the patients for giving care. And you will be prepared to face the challenges in the healthcare globally. So at Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research is a smart campus which has been established across 140 acres of land, which madam has shown you the slides of the pictures. And the programs what we offer at the College of Nursing Sciences is BSc Nursing, that is Bachelor Degree in Nursing, which is a 4 years of course, post-basic BSc Nursing, which is 2 years, MSc nursing with specialties. These are the 5 specialties like medical surgical nursing, pediatric nursing, community health nursing, obstetrics and gynecological nursing, and mental health nursing. These are the 5 specialties we offer in masters, this specialization. Then I would like to tell the eligibility criteria for taking up the BSc nursing course. The pass is 10 plus 2, the 12th grade or equivalent with physics, chemistry, biology, and English. Minimum of 45% of marks taken together in physics, chemistry, biology, and English. The eligibility shall be 40% in case of candidates belonging to SC, ST, and OBC. The eligibility for masters, for PBBSc nursing is pass in GNM or after 10 plus 2 or equivalent examination, preferably with the science subjects with 50% marks in aggregate. Candidates should be registered nurse, registered midwife, or equivalent with any state nursing council registration. Candidates should have completed their GNM course on or before and not cross 48 years of age on commencement of the course. The eligibility criteria for masters in nursing. Candidates should have passed BSc, PCBSc, or PBBSc nursing recognized by Indian Nursing Council and a minimum of 55% marks in aggregate, 15% marks in case of SC, ST, or category or OBC candidate from Karnataka. Applicants must have 1 year of experience after their BSc nursing in a hospital or a community health program or a school or college of nursing. PBBSc degree holders have to have 1 year experience either before or after PBBSc degree. Candidates should be registered nurse and registered midwife or equivalent with any state nursing council registration. This is the eligibility criteria for BSc, PBBSc, and MSc nursing courses. And as Dean Madam has mentioned about, we do offer a value-added courses such as lactation counselor program. We have the people who are specialized in these courses come and do the programs. Pain management, psychosocial rehabilitation, first aid program, and e-analysis, emergency nursing, life support certification courses we are giving. And we have a special, this thing is we have an MOU with International Skills Development Certificate. That is a Skills Development Corporation, which delivers an international certificate in healthcare practices in association with University of West of Scotland. This is a career enhancement program. And scope of nursing, as both all of them have mentioned about what is the scope of nursing as a profession. Madam Selma has also beautifully explained about the role of nurse, the nursing positions, and the employment opportunities as a nurse, chief nursing officer, clinical nurse specialist, nurse practitioners, nurse midwife, nurse anesthetist, military nurse, community health nurse, and others. An alternative career as clinical nurse, educator, public health nurse, forensic nurse, nurse advocate, telephonic triage nurse, and others. And academics, teaching and research. The industries, industrial nurse, medical coding and writing, quality control nurse, and clinical research. These are the different scope of nursing, better than all the other speakers have explained you in detail. And next is about the affiliations. We are affiliated to Karnataka Nursing Council and Indian Nursing Council, and we are proud enough to say that we, the Rayan Sagar University College of Nursing, are the first to initiate with this competency-based curriculum, that is a semester scheme which has been introduced through the Indian Nursing Council. We are the one first to start, and the first semester has already been taken, and it is a competency-based education which reflects the needs of the patient and being immediately relevant and applicable to the central role of nurses and caring for the patient. And these are the two we are affiliated with. And the clinical postings, parent institutions, we have Sagar Hospital, Tilak Nagar, and Sagar Hospital at Kumar Soni layout. And one is the Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research, and Sagar Hospital Bank. These are the parent hospitals. Clinical facilities, we have Victoria and Vanivilas Hospital for OBG nursing postings, for pediatric postings at Indira Gandhi Institute of Child Health, for psychiatric postings as Spandana Hospital and Nimhans. And these are the laboratory facilities, and apart from whatever Madam has showed, it's CD Simon. And the library facilities, we have more than 4,508 books and more than 15 of national and international journals. And apart from that, we, apart from concentrating on the academics, plus we celebrate all the health days. Celebrations have been carried out, and activities are extended and expanded activities are carried out. Our students also, apart from that, participate in other national level and state level cultural and sport competitions. And these are the student activities which have been carried out. I just put a glimpse of certain pictures which has been recently carried out at our college. Thank you so much.
Thank you so much, ma'am.
Thank you so much for giving me this opportunity, sir.
Thank you, ma'am. So here we are, students, a wonderful session. Two good industry speakers. We had the Dean ma'am presenting about the complete School of Nursing, the College of Nursing. We had the principal ma'am talking about in depth about the programs. We had the Vice Chancellor sir setting the context, giving the overall purview of how the programs in terms of the nursing sciences need to look upon. So here we are. In case if you feel that Dayanand Sagar University is the university for you to come work on your career aspirants in terms of being, taking up the nursing profession, we have 3 wonderful hospitals with us. One is right attached to our med school, one of the biggest hospitals that you can find in this part of the city, and get the best practical exposure along with the course. In case you want to be a part of the DSU family and be in one of the most beautiful campuses in South Bangalore, please visit dsu.edu.in. The applications are open. We have some seats available. You could look at filling up your applications, getting the eligibility clearance from our experts, and then looking at securing your admissions. If you have any queries, you can visit our website, as well as we have the phone numbers 08046461800. And you can speak to our career advisors. I'm sure they'll guide you. And this could be one of the best ways by which the best practical training along with your campus life can be obtained at Dayanand Sagar University. I'd like to sincerely thank all the distinguished speakers for the day. A special thanks to the Dean ma'am and to the Vice Chancellor of Dayanand Sagar University, and to all my lovely students who have taken out time, found this to be very important from their career point of view, and to listen to the experts, to see the guidance, which will help them to build confidence to select the program and to move forward. Thank you so much for your time. We look forward to seeing you soon. Till then, stay safe. Enjoy the evening. Thank you and bye-bye.